Welcome dear viewer to Take Care Show. My name is Dr. Ahmed El-Morsy, consultant orthopedic surgeon in the UK. My subspecialty of interest is shoulder and upper limb surgery. Previously we have discussed shoulder instability or dislocation as one of the main sports-related injuries that we face us and particularly our elite athletes. Today we're going to talk about the same topic but different type of injury. Still shoulder sports injuries, but particularly we're going to talk about rotator cuff. Rotator cuff is the tendons on the top of the shoulder. The shoulder is ball and socket, as you can see, ball and socket tendon like that, ball and socket joint like that, and on the top of the joint is what we call it rotator cuff. Rotator cuff is group of 4 tendons that has so many functions. One of the main functions is moving the shoulder and putting the shoulder in the right place. There are other functions in particular including stability, but this is not our topic today. Today we want to talk about rotator cuff injury. Rotator cuff injury, as I said, one of the main injuries in sports injury, particularly happen when fall landing heavily on the shoulder, that can cause direct injury to these tendon, one or more of these tendon. That can be painful, can be disabling, and if that is ignored, can be actually career changing or can stop an elite athlete or even anyone else to have a normal shoulder function. Again, as I explained before, do not ignore the first injury. This is not an exception. If you have trauma to your right shoulder, you have to see the right person who should be really specialized in shoulders, and this is where the treatment starts. So when you see the right person, we normally start by clinical examination, examine the shoulder, examine the function, spot which injuries you've done. That would be usually followed by investigations. The investigation modality of choice is usually MRI scan. In some cases, we get ultrasound scan. Based on that, we spot the problem. If it's as we were expecting, it is rotator cuff tear, then the treatment plan usually start with a course of physiotherapy, some conservative treatment. But particularly in elite athletes and in traumatic tears, we usually go for repair of the tendons. The repair of the tendon can be done through keyhole surgery or what we call it arthroscopic procedure. We use sutures and anchors, which are really small, about 3 or 4 millimeters anchors to repair the tendon. That's not everything. The treatment now to continue for physiotherapy. You can't really rely on operation at all. It has to be followed by physiotherapy. The aim of this, proper diagnosis and timely manner, proper diagnosis, right modality of investigation and proper treatment followed by physiotherapy. The aim of all that is to get you back to normal function, normal daily activities as soon and as safe as possible. Particularly for elite athletes, time means a lot, so the aim to get you back to your normal level of competition as soon as possible. Again, the advice is do not ignore the first injury. Thank you for watching. Take care for yourself.